May is Brain Tumor Awareness Month. Brain tumors can happen to anyone, and they do happen when a single cell in the brain mutates and multiplies more quickly than other cells, leading to a growth. In today's Your Healthy Family, a Naples woman is sharing her story with the brain tumor and the warning signs she had.
It was in November.
Last year, Kelly Moore, a busy flight attendant, got a diagnosis that stopped her in her tracks.
I was sitting there with my mouth open. I was in shock.
She had a bad sinus infection and went to an ear, nose, and throat doctor with NCH healthcare system.
And I have hearing loss in my left ear, which he thought might have been connected to my sinus infection. And he said, if you don't oppose, well, you can have a CAT scan and an MRI.
30 minutes later, she got the call.
He just said to me, are you okay? Are you sitting? We found a large mass in your brain. My stomach dropped.
And 2 hours later,
it's a scary diagnosis.
She was in Dr. Edison Valle's office with her husband.
This tumor was located in the frontal area, the area that controls basically how you interact, your mood.
Dr. Valle, a neurosurgeon at NCH, gave me these images of Kelly's tumor.
More impressive was the size of the tumor that she had, compromising both frontal lobes. It was probably 4 times the size of her eyeballs. We can see in this picture in here, these are the 2 eyeballs, and this is a tumor that she had.
Still, Dr. Valle said Kelly's tumor was a meningioma. It was curable, and he told her she would make a 100% recovery.
The appointment was almost over. Dr. Valle just looked at me and said, I want you to stand up and walk out of this room and consider yourself lucky. He told me to go home and enjoy Christmas. He said, you've been walking around with this for 6 years? I said, I have to work the next day. I have to work tomorrow. He goes, go to work.
In January, Kelly went back to NCH for brain surgery.
Tumor was completely resected.
Dr. Valle says using an MRI with navigation protocols,
This is a map of how the brain fibers are connected.
They're able to create a sort of 3D GPS of the brain and tumor.
We use that technology to map out the brain and to merge that with the instruments that we're using at the time of the surgery and the microscopes that we use,
allowing the procedure to be minimally invasive and recover patients like Kelly faster.
Within 5 days, I went home and I was walking and talking.
Dr. Valle estimates Kelly lived with this tumor for 6 years. Looking back now, she tells me she didn't realize at the time the signs something was wrong and how much her tumor was affecting her mood.
I just was really pushing myself through life. I was always exhausted. I just thought it was my age, I'm busy.
But now,
I have a new lease on life. It's kind of a cliche, but it really is. It's true. I just always have like this big smile on my face now because I feel so good.
She really is so lucky. Now, you just heard the warning signs that Kelly had, changes in her mood, tiredness, but there are other symptoms of a brain tumor. We're going to talk about that more in tomorrow's Your Healthy Family. I'm Lisa Greenberg, and for more health stories, head to fox4now.com/yourhealthyfamily.